I'm Dr. Tieche from Recharge Clinic, and one of the things I wanted to talk about today is we're starting to hear some smoldering about a new COVID variant that's out there, and everyone is pretty much sick of hearing about this stuff, but I want us to all be aware that it might be percolating. So what I wanted to do is give you some reminder tips of how to keep yourself safe. They're really basic tips that people should do. Frequent hand washing. We should do that a lot, particularly before we touch anything on our face. The average person touches their face about 20 times an hour. That's pretty significant. So our hands are always going up there. You put your hands on the counter or a door, and then you stick them in your mouth, and then you wonder why you're sick. So that's important. Really frequent hand washing, particularly before you eat, before you do anything that might be putting anything near your mouth. Secondly, really nasal protection. That's another thing, particularly when you're going to be in crowds or around people who you think might be sick. You go to a concert, you go to a movie theater, or in an area where you may not know. There's two things that people do, and these things have been definitely shown to prevent and cut down the incidence of both viral infections like the flu and COVID. It's very well documented. So one thing is just called nasal lavage. What does that mean? Well, you irrigate out your nasal passageways with saline several times a day. So that's one treatment. The other is using some specific treatment medications at work. One, you can swab the inside of your nose with mouthwash, which sounds weird, but you just put a tiny amount in there. It actually prevents viral replication. The third nasal preparation, which is very, very good, is a medication, or it's actually not a medication, it's a product called Cofix. And it is a combination of, and this is actually it right here, it has a combination of iodine and some other solutions that make it a little bit sticky on your nasal passageway. And so what happens is the viruses come in, they stick to that stuff, it's not like glue or anything, it's just very sticky for the virus, and then the iodine helps prevent virus replication. So it has been shown over and over again that just using this when you're going to be in those crowds or around people that are high risk, it actually lowers the threshold of having that, even better than wearing masks. So this is another thing that you should try doing. What's another thing we do? Well, we want to keep our vitamin levels up. We know that vitamin D, it really helps prevent infections, and so keeping vitamin D levels up. So most people should take anywhere from 2,000 to 5,000 units of vitamin D. Zinc is another thing. You should take about 20 to 40 milligrams of zinc per day. The other thing is vitamin C. You want to take plenty of vitamin C to keep these things up. And then the other thing is there's either things like elderberry or quercetin, and these things also help prevent viral infection. So they're very important to keep these levels up. So the other things that you want to do, kind of basic, just human care. Get plenty of rest, eat right, exercise, all of that stuff. But particularly do these things when you know you're going to be in areas that are high risk or high exposure, going forward. Like I said, concerts, movie theater, big crowds of people, So that's one thing to really try to do to prevent it. And now, if by the bad chance that you do get something like that, I want you to know there are still great treatments that are out there available. There's medications, there's IV infusions, there's, ivermectin, and as well as antibodies. So don't be scared thinking, oh my gosh, we got a lockdown again. It's not even at that level, but I just want you to know, take all the precautions. If you would happen to be sick or get sick, we can take care of you.